Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Knee replacement overview. Introduction. Severe arthritis in the knee can lead to serious pain and inability to walk. Doctors may recommend surgery for people suffering from severe arthritis in the knee to decrease the pain and to improve the patient's ability to walk. If your doctor recommends total or partial knee replacement surgery for you, the decision whether or not to have surgery is yours. This program will help you understand better the knee with arthritis and the benefits and risks of this surgery. It will also help you to understand how to prepare for the surgery and your recovery at home. Anatomy. The bones involved in the knee joint are the following: the femur or thigh bone, the tibia, one of the lower leg bones, and the patella, also known as the kneecap, a floating bone that gives the knee its round shape. These bones are covered by a special tissue called cartilage. The smooth surface of the cartilage allows for smooth, painless movement at the knee joint. Ligaments connect the bones and help stabilize the knee. Symptoms and their causes. Arthritis or inflammation of the joint causes the surfaces to become rough. This results in severe pain and even inability to walk. Knee arthritis can result from arthritic conditions such as osteoarthritis, a chronic wear and tear of the joint, or may be caused by an old injury. The pain may interfere with normal work and activities. Walking may become very difficult. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Alternative treatments. Patients may try medications such as aspirin or ibuprofen to decrease the inflammation in the knee joint. Physical therapy may also help keep the joint as mobile as possible. The use of a cane or walker may also help. Injections of steroids in the knee joint may help the pain and reduce the inflammation. Hyaluronan is a natural substance found in the knee joints. It acts as a shock absorber and lubricant. Injections of hyaluronan-containing liquids in the knee joints have been found to help with some of the pain and improve functionality. For overweight patients, losing weight helps reduce the stress on the knee joint. Losing weight also increases the success of the knee replacement operation if it is indicated later. Preparing for surgery and discharge. There are several things you will need to do to prepare for surgery. You will also need to make plans and prepare for your time after the surgery. Your healthcare team will help you with this. Your healthcare team will ask you to do certain pre-op exercises to prepare your knee for surgery. Eat a healthy diet both before and after surgery. This will help your body be ready for surgery and help it heal. Do not eat or drink after midnight before your surgery. This includes water, gum, candy, and mints. The night before the surgery or the day of the surgery, your healthcare provider will ask you to wash the skin on your body with a special soap that kills germs. This soap decreases your chance of infection. The morning of surgery, take only those medications that you were told to take by your doctor and the pre-surgery nurse. Make sure you have transportation home. Someone should stay with you for 2 to 3 days and nights after you get home from the hospital. Have someone who can help you stay steady when you walk and help out with everyday tasks like cooking and laundry. Also, prepare your home ahead of time. Remove throw rugs, have rooms and hallways well lit and clear, and have a cordless phone with you at all times. Think about having frozen meals on hand or the services of an agency like Meals on Wheels. Get or arrange to get all of the equipment you will need at home after surgery ahead of time. This may include a walker, exercise aids like rolled towels. Your therapist will advise you about bath benches, reachers, and other adaptive equipment you may need. Surgical treatment. The operation is done through an incision in the knee area. It usually takes 1 to 2 hours. The parts of the femur and tibia are cut and removed where they join each other. The removed parts are replaced by artificial surfaces known as prostheses. Depending on the type of prosthesis, it may need to be cemented to the bone. Some prostheses do not need to be cemented. The bone surrounding the prosthesis grows into it and acts like cement. Most knee replacements involve the whole joint. However, at times, only part of the knee joint is affected. In such cases, the orthopedic surgeon may decide to replace only the inner or outer half of the joint. At the end of the operation, the skin is closed. A drain may be used to remove excess fluid. Risks and complications. This operation is very safe. There are, however, several possible risks and complications which are unlikely but possible. You can do a lot to help prevent some of the complications. Anesthesia is very safe, but it carries some risks. These risks will be discussed with you in detail by your anesthesiologist. Blood clots in the legs can happen. They usually show up a few days after surgery and are dangerous. They cause the leg to swell and hurt a lot. Moving around and exercising your legs after surgery may help decrease the risks of blood clots in the legs. Special compression devices and tight leg stockings can also help prevent blood clots in the leg. Your doctor will also give you a medication that helps prevent blood clots. Your nurse will tell you more about this. Routine blood tests may be needed after you leave the hospital to check on how your medication is working. As with any type of surgery, knee replacement surgery carries the risk of infection, bleeding, a skin scar. After the surgery. After surgery, you will be taken to a room for recovery. You will have a sterile surgical dressing surrounded by an ACE wrap to protect your new incision. There will be devices and machines attached to you. There will be fluids running into your veins through an IV pump. You may have a pain pump attached to you that you can control for pain. This depends on your doctor's preference. Antibiotics will be given before and after surgery to lessen the risk of infection. You may have a reinfusion drain. This is a drain that collects your blood and filters it so it can be given back to you as a blood transfusion. Some patients have the drain that collects blood but is not given back to them. You may have a tube placed in your bladder to drain your urine. You will not need to get up to use the bathroom while this tube is in. If you don't have the tube in your bladder, you will be given a urinal or bedside commode to use if you need to empty your bladder before you begin walking with therapy. You may need a blood transfusion, either from donor blood or your own blood if you donated before surgery. You will be given oxygen after surgery and asked to use an incentive spirometer. An incentive spirometer is a device controlled by you that encourages deep breathing to help prevent pneumonia and other lung infections. It is also important that you cough and deep breathe in order to expand your lungs. Your oxygen level will be checked after surgery with an oximeter. The oximeter has a painless clip that fits over your finger that projects a light that can detect the oxygen content of your blood cells. After the operation, depending on your specific condition and your surgeon's preference, a continuous passive motion machine, also known as CPM, may be used for physical therapy. This machine bends your leg back and forth while you are resting in bed to help increase the leg's mobility. Your healthcare team will tell you how much and how often you need to wear the CPM and help you set goals. You may use it more or less than your goal, or even not at all, depending on your surgeon's recommendation and your pain level while using it. You may wear support hose or compression boots after the surgery. These help reduce swelling and can help protect against blood clots. Ice will be applied periodically throughout your stay to help lessen swelling and discomfort. You will need some type of ice pack at home. Apply it 20 minutes 2 to 3 times a day. Over time, you will be able to increase your activities under the direct supervision of a physical therapist. You may resume most of your activities eventually as you gradually strengthen your thigh and leg muscles. You may need the help of a cane or a walker initially to take the pressure off your new knee. Over time, you will more than likely be able to walk without any aid. As soon as the day after surgery, you may be visited by a discharge planning nurse. He or she will assist you with making arrangements for equipment and assistance you may need at home. If your doctor orders any special medications requiring a shot, such as blood thinners, for use at home, you or your family member will be taught how to give the injections. The usual hospital stay for this surgery is 1 to 2 days. Some patients go home the same day. If your condition indicates that the services of intensive physical therapy or specialized nursing are required, a 3-day hospital stay and a short stay in an extended care facility may be needed to improve the outcome of the surgery. If you need this, the discharge planner will help you with the arrangements. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Knee replacement is very successful in helping decrease pain and improving quality of life. This operation is safe with good results. However, as you have learned, complications may happen. Knowing about them will help you detect them early if they happen. Working with your healthcare team to prevent complications will help you to have a more comfortable stay and lead you towards home. Thank you for using Explain.